Good morning, Denise. This is kind of neat. This is the first Skype we've done being actually in a classroom here. Where is this classroom at?
I'm located at the Pima campus in Mesa, and I'm in the respiratory care lab, in our simulation lab. Wow,
this is amazing. I'm so impressed with seeing this, and this is what students will be working with when they go into this field, right?
Correct. Yes, it's one of the modalities. A typical patient, particularly now with the pandemic, that many of the patients are on a BiPAP setup like we have this gentleman on right now.
Wow. Let's talk about this program because, again, this program is really what we're starting to see is going to be needed coming up very soon in the medical field.
Exactly. There's always been a need for respiratory care, but typically, I mean, right now with the pandemic, it's really brought us into the forefront of what's going on in healthcare. We are the people that are at the bedside whenever there's a need for an airway to be stabilized, or if there's an airway that needs to be intubated, or if it's a patient that has airway obstruction. We're the folks at the bedside doing that.
So, okay, how long does it take to get through this program?
How long is the program?
Yes.
The program's a 22-month program, and at the end, the students earn an associate degree. And then they're eligible to take the credentialing exam for the CRT and the RRT, the Registered Respiratory Therapist.
So, okay, and through this, what are they learning?
Oh, learning all types of things. We start out with the students with just basic patient care assessment, and then all of the disease processes that we see in the hospitals with the patients, but then also all of the modalities. So anywhere from taking care of a patient that is asthmatic or a COPDer, or in the NICU, we are also part of that team at the bedside of the newborn infant and the preterm baby for life support. And then at the end of life, we're at the end of life for that whole process for patient care.
Wow, I'll tell you, it's amazing how important this program is. And again, you're in the simulation here. I want people to realize that as if you're just checking in with us. Okay, I'm seeing is that a real person behind you?
No, it's a simulator. This is Hal.
That's Hal.
This is Hal. So he pretty much will do almost everything that we need to simulate patient care for the students here. He has a heart rate. We can intubate him. He has a pulse. We can have someone outside of the room simulating that he's talking to the students. You can see that he's blinking his eyes.
Yeah, that's what got me. I'm sorry, Denise. That's what I saw, the eyes moving.
You saw the eyes?
Yeah, and I was like, what's going on there? And so, but this is the things that the students, will be doing.
Right. And it's so important that students not only get comfortable, but they understand some of those processes before they get to the bedside, so they're more confident. And then obviously the patients are more confident that we've run them through the drill here. It's an awesome opportunity.
Yeah, I like that Pima Medical Institute has this in their program, because I know some other programs we've talked to pretty much just have the classroom and then you get a chance here. But with COVID going on, they haven't been able to really get the students into the kind of like the situations that you're doing right here.
Right. So currently right now, our students are in virtual classrooms. So we're doing the Zoom type lectures, but we are also bringing them back in small groups here on campus to get the simulations done, to get them checked off on mechanical ventilation and life support, so then they can continue on into the hospital settings to do their clinicals, because obviously there's a huge need for respiratory therapists right now.
Yeah, there is. All right, how can people find out more about the program in Pima Medical Institute?
Just visit our website, pmi.edu. That's the easiest way to start there.
Thank you, Denise, very much, and I hope he feels better.
I'm sure he will. Thank you.
Thank you.